in. Okay, Shelley, roll call, please.
Yes, sir. Mike Dobbins.
Here.
Dora Petzkowski. Keith Austin. Danny Callison. Julia Coates. Sean Crittenden. Joe Deere. Rex Jordan. Johnny Kidwell. Darrell Legg. Wes Snowfire. Joshua Sam. Mike Shambaugh. Melvina Shotpouch. E.O. Smith. Condessa Teehee. Victoria Vasquez. We have a quorum.
Thanks, Shelley. Hopefully you've had a chance to look at the minutes. Are there any corrections to the minutes? If not, I'd entertain a motion to approve. All those in favor of the minutes? Passes. Thank you. Okay, on to reports. Mr. George Valier. George.
Good afternoon.
Good afternoon, George.
Thank you. My report is in your packet. Our 7-day positivity rate for COVID testing is 24% today. Through the month of August, we've given 29,491 vaccinations and performed 26,544 tests. Just for the month of August, we did 3,004 tests. 1,864 of those were on Cherokee Nation citizens, and 435 of those were positive. Dental, for the month of August, we had 406 patient encounters with a total of 3,553 services provided. The lab saw 2,786 patients and ran a total of 47,557 tests. The outpatient pharmacy for the month of August filled 29,655 prescriptions, mailed out 11,891 prescriptions on our mail order. Are there any questions?
Joe?
Hey, George, how are you?
Good.
Hey, in your contract health, do you have people working at home and then some at the office?
Yes, sir.
Okay, because I've got a couple of calls, I've just verified with you. They're about referrals not being answered as far as people when they call in, because some of those people are at home. Is that slowing the referral process down?
It should not. The docs still meet every Tuesday to go over the referrals. If anyone's having trouble contacting the PRC office, please give them my number.
Okay, yeah, they're just having trouble contacting people in the contract health office.
And they're
not answering.
Those numbers should be forwarded to their home numbers.
Uh-huh.
But if no one is answering, tell them to contact me, please.
Okay, via email or phone, either way?
Either way.
Okay, that was just an issue that's been recently.
If that's going on, let me know and I'll get it addressed.
All right, thank you.
You bet.
Thank you, Chair.
Okay. George, you mentioned first line that you tested roughly 3,000, about 1,000 of those were Cherokees, roughly.
Yes.
Can that be a reflection totally? Is about a third of your patient care involved Cherokee citizens?
On the testing, it's about half, a little more than half of on the testing.
That are Cherokees?
Yes.
Okay. Is that in total? Is it roughly half of Claremore Service Unit serving Cherokees, half, or is it less than that?
Oh, it's greater than that. I think
Greater
it's.
than half.
Oh yeah. I think we're probably between 60% and 80%.
Okay. I wasn't aware of that.
Yes, and on my report that's in your packet there, I break down our ambulatory services and dental by number of Cherokee Nation citizens.
Yes, them now.
Yeah.
Thank you. Yeah. Okay, great. Thank you, George. George, at the Claremore unit, do you monitor those that have recovered from COVID? Do you keep data on how many that have recovered from COVID?
I can get a number for how many that we've discharged out of the hospital.
Mm-hmm.
I don't have that with me, but I can start reporting that.
Mm-hmm. So does the Claremore unit, do you offer, like, those that have surfaced on the other side of COVID, do you offer them the option or the ability to be tested for the antibodies later to see what their level of antibodies are after they've recovered?
They can come in and get tested anytime. Yes, yes.
So you offer the antibody test for your beneficiaries?
We do that and we can send it off, yes.
Okay, all right, thank you. Any other questions for George? Thank you, George.
Thank you. Have a great afternoon.
Okay. Dr. Jones.
Good afternoon.
Hello.
Well, today is the first day that we've kind of had a combined report where we combined public health into our health committee reports. So I'm going to have Lisa come on forward and go ahead and give her report up front, and then I'll finish with mine, and that way we'll leave a little more time at the end for questions. So if you don't mind, we'll go ahead and do that at this time, if that's okay, Mr. Chair.
It's fine. Ms. Pivot.
Good afternoon. Glad to see all of you again in person. So I'm happy to report on the public health report for this month. It should be in your packet, and I just have a couple of things that I would like to highlight in that report. One is that we're still in the process of doing our tribal health assessment, and we still have a community survey that's out until October 17th. It's still open for anyone to answer. It's just general questions about health needs, beliefs about health in the community, and that can be found on the Public Health Facebook page, Cherokee Nation Public Health Facebook page. The other thing that I can report on today is for CDC, Center for Disease Control and Prevention. As you know, Deputy Chief Brian Warner is the chair of the Tribal Advisory Committee for CDC. And in August, we were able to actually virtually meet with CDC for 2 days. And during that time, both Deputy Chief Warner and myself were able to address the Director of CDC, Dr. Rochelle Walensky, and give her our comments about how CDC can make relationships better with tribes. The other thing I'd like to highlight is if you'll look at the expenditures for WIC under food sales, I think sometimes we forget that how much money WIC puts into the communities, into the local grocery stores, and without September's numbers, we're already up to 3.2 million worth of food sales in the communities. You'll also notice that our wings races, although they're still virtual, are actually maintaining about the same attendance as our races in person, so interesting. And as far as COVID, over the last 2 weeks, the number of COVID-19 cases have plateaued and is about 250 per week. While this is well below our peak during the surge of over 1,100 cases in a week, there is still widespread community transmission of this highly contagious and deadly virus. So we need to not let up on our mitigation measures is the most important thing. We're getting control, but we don't need to let up. CDC recommends that you be vaccinated. They recommend wearing a mask in indoor settings, especially in public places. They do not recommend outdoor, but if you're outdoors in close quarters with folks and a lot of crowd, like a concert, they do recommend masking. hand washing, and social distancing. And that is all I have for you today. I'm happy to answer any questions. Yeah, yes.
Wes?
Ms. Pivick, since summer's now concluded and we're getting a little bit better weather, it's cooling off, a lot of our citizens, I know in my district, have been wanting to get together, having gatherings and whatnot, and myself included has gone to the gatherings because it's good to see faces, good to talk, and we have to share concerns, and that's how we can try to problem solve. We haven't been able to have our community meetings for some time now. The CDC, they're still recommending that, obviously like concerts to avoid masking. If we did an outside community event to gather some of our people together, if we did social distancing, is that safe to do an outdoor event so we can get together and maybe be able to speak to kind of a crowd of constituents on what we're doing at the nation and also hear from our constituents in a public forum their concerns in a safe way? Is there any suggestion maybe that you should do, offering masks or make sure that we're requiring masks?
In a situation like that, I'm not sure what kind of numbers you're talking about,
Yeah.
but CDC would probably recommend that you have masking, even if it's outdoors, if it's a lot of people and they're going to be in close proximity.
Okay.
And especially if you're serving food outside,
Yeah,
they would definitely recommend social distancing. I would probably recommend holding off a little longer if you
Okay.
can, because those events are really hard to keep
Right.
the mitigation measures. Although you put them in place, it's really difficult to not pull up your lawn chair next to somebody you haven't seen in 6 months and start going to talking, and be probably hard to keep the masks on as well.
right. Right, okay, all right, that's all. I appreciate the suggestion on that. It's something that we're looking forward to, but we want to make sure
Right.
we be as safe as possible, so
Right, yeah.
appreciate it, Chair.
Yeah, thank you.
Any others? Lisa, could you explain a little bit? I know you helped me with the Muskogee County Health Profile. Where are we in terms of getting other counselors, kind of a breakdown in their districts with those profiles?
I actually received an email from the epidemiologist, Dr. Blair, who is doing those county profiles this morning, that she was going to be, since COVID has slowed down, she's able to get back on and get those completed. I don't think it will take very long once she has the full time to pay attention to it. Of course, we need to send it through communications and get all those things vetted before we hand them out, but it shouldn't be too long, right? We were almost there when this next surge hit, and we had to put it off. So I think I think she'll have them done within the next month, but we also have to get them vetted as well.
Okay, all right. Thank you, Lisa. Any other questions for Lisa? Thank you, Lisa.
Thank you. Nice to see you.
All right. I have a few things here. I've got a handout. It did not get printed off correctly, so I apologize for that. So it's every 2 sheets, okay? So it should have been front and back, but they did not do that. It's front, and what would have been on the back is on the next page. So if you'll take them and take 2 sheets and pass it down, I appreciate it. This is our community vaccination events. It's on the website, but I want to get it out to you guys too, just in print, so you'll have it if you want to have a copy of it to refer to, so. And they're having one today that's not listed on there, right up here at One Fire Field, and you can get your flu vaccine or your COVID vaccine, either one, okay? All right. We'll go through the Health Committee report first and just hit some of the highlights that we normally hit. Vacancy rate for providers is at 2.8%, which is very low. The referral approval rate for purchase referred care or contract health service, whichever one you want to call it, is 96.4%. Now keep in mind, these are August numbers that we're looking at, because everything runs behind when we're actually talking about it. And then if you look at the ambulatory visits, you can see that they're increasing across the board compared to what they were the year, months before by clinic there. And then third-party revenue, we're way over what we had projected or what we were last year by about, looks like 47 million as of August, above what we had projected or what we were the year before at 119.7. So everything's coming back online and starting to get going again. We are, as of this last week, we opened up our elective surgeries back to 75% capacity. As we've seen the hospital numbers start to come down a little bit, then we've opened up elective surgeries, the inverse of that, and gone up a little bit. We're not there where we're at 100% yet, but we're at 75% on the scheduled elective surgeries. And then we opened dental services back up on October 4th to full capacity, so they're back up and running as they should have been by this time. Vaccine update, we are doing community events. I just passed those out so everybody would have a list of them. And again, we're at One Fire Field just up the road here today till 4 o'clock. So we have our nurses out there and can get a flu vaccine or a COVID vaccine, and you can get the first vaccine if you're on the second and you're due today. You can get the second one there. If you're at that point where it's past 6 months and you're eligible for a booster, you can get a booster there. So just FYI. Currently, we've done over 81,000 vaccines. I think it's 81,200 or around 200, something like that. You can still call and get an appointment if you call and schedule one and that same number applies, the same number we've passed out every time, the 1-539-234-4099. So you can call and get an appointment, or you can walk in. All of our clinics are giving vaccines, and if you don't have time for an appointment, to get an appointment, but you have a little time spare during the day, you can walk in and we'll get you vaccinated. Testing, we are still testing every day. We have pulled back because the demand has pulled back so that we could get our people back to their regular positions the first day of each week, and today be the first working day of each week. So today, Tuesday works, but the rest of the time it's on Monday. We will be in the drive-thrus from 12 to noon. From 8 to noon, and then we'll pull back into the clinics and it'll be curbside. So the rest of the week it's curbside, but it is available at all of our clinics every day. It's just not going to be out in the drive-thru where you can pull through. We were just finding the numbers were too low, and we had a lot of people allocated to that. We need to pull them back into the clinics to do their regular job. Hospital numbers are dropping off, like we said. Currently, the report I got this morning is we just had 1 ventilator running, and we had 9 admits with COVID, which is down quite a bit from where we were the last time we talked here. So we continue to have a full hospital, but it's things other than COVID. And as you know, the hospital's not all about COVID. So looking at this morning, we only had 8 beds available. Our ICU was completely full. So outside of COVID, we still have disease processes that we're dealing with and things of that nature. And then the last thing I want to report on is Medicaid expansion. We're still working very diligently to offer that to all of our citizens that are uninsured. We've so far signed up 6,934 since July 1st, and that gives that's 6,934 citizens that had no insurance or no third party at all that now have something other than just health. They have the other benefits of Medicaid as well. So it not only helps us and helps our contract health or preferred care dollars go further, but it also helps their families. So we're very proud of that, and we've got goals set for the end of the year, so we're working very diligently to keep making those phone calls and offering up, educating people that's why they should sign up and get that gap closed in that group that's uninsured or has no care when they were left out before the Medicaid expansion. So other than that, that's all I have for you today, and if you have any questions, be glad to answer them.
Yeah, I got a 4-part question.
Okay?
Answer any order you want. Hey, on the boosters, when you're doing those, are we doing those in phases, or are we having to show a card like we're due, and I knew there was a time, 8 to 10 months or something?
6 months.
6 months?
6 months, yeah, 6 months past your second shot, and there is some criteria they laid out, but if you look, if you read it closely, the last part of that criteria leaves it pretty vague. If you remember back whenever we started doing the phased-in approach, back in the beginning, it was because we were short. We didn't have enough vaccine to do everybody, so we were prioritizing our levels or our phases by need. And now we do have vaccine. We have plenty of vaccine on hand. So if you feel like you fit in that high-risk category and it's been past 6 months, we're going to give you a booster.
Okay. That was one, and
And
it's
that's
a Pfizer, right?
That's Pfizer.
That's what, yeah.
Moderna or J&J have not been approved. They are going through the approval process, but they have not been approved yet.
Okay.
Pfizer's approved from 12-year-old and up. Moderna is not. It's not for children. It's just for adults. And then, and they've also filed for approval from 5 to 11, and that's going through the approval process now. We hope to hear something by the 1st of November.
And that's going to be available with these people on this, right? The booster? Okay.
Yeah.
The next thing is, they used to have the health outreach that could come to events. It was Connie Donovan. Is that close to getting where they can go back to events? Or?
We haven't been given the clearance to do that yet, so we're waiting for when it's so safe to start gathering people up.
When that does, can you send me an email that it's
Sure.
good, because we have a list of events?
Yeah.
And then last, I haven't asked this in a while, is the reorg still going on? Are we doing the pandemic? We had talked about the reorg a while back.
For which?
For health, we were just talking about the whole reorg for a while.
We don't have a overall health reorg going on. We have some different departments that are being
Right.
reorged, but we don't have an overall health reorg going on.
Right.
But we are trying to standardize and get our alignment correct so that everyone's standard throughout the system, rather than having these little pieces that are different at each location.
Yeah, and I knew that's what we were doing. I just didn't know with all the pandemic stuff on everybody's head if that had, we
We're
had
still
put that
working
to
on
the
it.
burner
We
or
put it
not.
on the back burner for a while, but now
Yeah.
that things are starting to slow down, we're starting to bring it back to the front to work on it.
Yeah, that was all I had. I appreciate it.
Yeah.
Thanks, Chair.
Part of my question was answered. I was going to ask if you had boosters was available at these
Yeah,
sites.
they are.
I saw where there was a job opening for patient representative or something. So that's for the insurance and all that.
Patient benefit coordinators.
So
mhm.
it's addition to patient service advocate, right?
For what?
For any clinics, where they have the patient service advocates.
Yeah, we're trying to beef that area up at all of our clinics, because there are a lot of people out there that are looking for what help we can give them. And again, with Medicaid expansion, that's another area where we can help people get enrolled, and it gives them a variety of benefits, not just healthcare.
Care. Well,
So,
that's good.
yeah, that's part of our approach, or our strategy is to get that department increased at all the different locations.
Well, that's great. I was glad to see that. Thank
Yeah.
you.
Yeah, when you're talking about the booster, about Pfizer, does it matter? Is it compatible with Moderna? So-
Not really. They don't recommend that. If something happened that you did get it, there's nothing, there's not somebody coming in saying you shouldn't have done that. We don't recommend it. Obviously, we want to keep you in line with the same manufacturer that you got before.
Right. Well, I knew there was differences between the two vaccines. That's why I kind of figured it would be. Thanks, sir.
There's a lot of difference between the Moderna, Pfizer, and, Moderna and Pfizer are very close. The way that the platform that they're on, the J&J is a completely different platform. So, yeah, we don't recommend interchanging them at all.
Okay, thank you.
Dr. Jones, has the nation ever looked at getting rid of the plastic bottles that the medication is shipped out to, and using a vacuum pack type, something that may be more environmental friendly than what these medicine bottles are? Is that something they've looked at, or is that something we've looked at before? Or?
Not to my knowledge. We've never looked at that. Right now, we are doing taking a complete look at pharmacy services. We've got a consulting group in right now giving us a overview of everything from the ground up. We're looking at it from from the ground up. So that may be something they come back and recommend to us. We're waiting on their assessment before we start moving on anything, because they're still in the analyzing phase. But one of the things we realize is that every patient, no matter what department you go to, touches pharmacy in some way. So that's an area that we can vastly improve and make a little more customer service friendly and a little more efficient. We want to be able to be the same as what you find out in the private sector. So we're looking at all the ways we can improve, and I'll bring that up and see if that's something that's a viable solution.
Okay, one other question. If a doctor recommends a medication outside the system, okay, and they have to go to an outside pharmacy to get it, and I had an elder that his medication was $180 out of his pocket, is there anything that the nation does to subsidize that or to help with that, or is there any way we've looked at maybe at least getting it at a cheaper cost?
So there are a few things that we do. We usually try to have, if you're a provider and you have recommended a medication that's not on our formulary that we don't cover, and like you said, you have to go outside to get it, then we are trying, or I guess we recommend to that provider and to work with whoever is in their area, their clinic, to contact the drug company, make contact to see if there's other ways to get those things paid for. We don't pay for it ourselves out of Contract Health or anything like that. But there are a lot of these drug companies that have programs that assist with the cost of medications. And more than not, our citizens qualify for those. So a lot of times we're able to help them by just getting them signed up that either gets the medication completely paid for in some cases it gets it greatly reduced. So we are working to try to help those situations, but we don't have a vehicle to pay for it or to purchase that medication. Yeah.
Dr. Jones, on the patients that you've seen recently relating to COVID-19, their average age, do you keep stats on their age?
I can't say for sure. I'm sure we do because we keep stats on everything. I haven't seen a report that shows on our specific patients that have been admitted. What we see is regional information and sometimes state information that we pull out. We have seen a drop in the age group, of where it's some increases in COVID activity in the 30, 40-year-olds versus where before it was 50 and 60-year-olds. I think the percentages are still somewhat similar, but there has been an increase in those two age categories as we've watched it. So there's definitely been a little bit of a shift.
Yeah, I've certainly seen it in local area where the people that I've known, much younger folks are being affected in a very profound way. Also, the length of stay. Has the length of stay gotten longer or of COVID-19 patients, or is it getting shorter because we're getting better at treating it? Or just what is?
That's hard to quantify, and the reason for it is because it attacks everybody differently. Now, we have been able to do the monoclonal antibody. As soon as someone gets diagnosed or tests positive, we're immediately on the phone. In some cases, we'll get the monoclonal antibody the same day to them, and that has shown to keep people out of the hospital. So we have gotten better at treating it. We've kept a lot of people from getting severely ill or ending up in the hospital by using that modality or that tool. But it's so different on how it affects different people, and you really don't know. There's not a predictor there that says you're going to be okay and just have a mild case and you're going to be on a ventilator. It's very unpredictable.
Do you have any patient? When you offer the monoclonal
Antibody?
antibody to patients, do you have a substantial number of patients who wish not to do that yet?
Not that many that refuse it. Most of them, some of them have heard that we're doing that, so they're calling us, even if they test positive outside of our system. So it's not. It's accepted broadly. Yeah.
Good, excellent. Thanks.
I've heard some rumors of hazard pay for some of the health employees. Is that being offered?
There's a Some information went out for premium safety pay. I don't think they're saying I don't think it's titled hazard pay, but we are looking at some opportunities to reward those that have stayed and, came to work every day and even in the midst of the surges and things of that nature, so.
Well, the one thing I did notice in being at a couple of different clinics, that COVID testing, a lot of it's being done in my area by our dentistry. And they're screening. They're actually giving shots. I guess people who give shots, during any dental procedure, they're giving shots. So, I just wanted to make sure those people are being recognized too, because even the ones before them, that's a daunting task to do for them. And they put themselves in danger, put their families in danger. I mean, that's just the way it is. And I was just making sure that they, would be recognized too, because they've all done their part.
I agree, and they've really, we've had people all over our system that have stepped up, when we've had needs, and we couldn't put a nurse there because we had to have the nurses in the hospital, or,
Right.
And we've had to backfill with other professionals that have the ability or the licensure to be able to do, as you said, give injections or do testing, and can't speak highly enough of how our health system, our teamwork, and how each department has stepped up and just gone above and beyond. So couldn't be more proud of them. They're just doing a fantastic job, but I will tell you that as things have slowed down, they're glad to get back to doing their other jobs. So
I'm sure.
So we're seeing we're trying to do that as quickly as we can, but no, it's been humbling to see when as soon as you put out a need and say we need somebody, people are stepping forward and I'll do it. So that's been a very rewarding to see how we view and work as a team.
Well, I just want to let you know too that they, they're very upbeat. When you talk to them, very upbeat, and they know what they're doing is very essential for the health of our nation. So, I mean, they are really have good attitudes. When I talk to them, they're very upbeat and have good attitudes, and even through all the stuff they've been in the hardships. So I just wanted you to know that.
Well, I appreciate that, and it's part of being something greater than yourself. And so that's the way that, we see this, is it's a chance to step up and really be an asset to your community, to your family, because most of these people work in the communities where they live. So it's not only their family, but their friends, their neighbors. And so to see that and see that desire to be a part of that is humbling. It's very encouraging to see how everybody has stepped up.
So that pay you're talking about, who does that go to?
It's broken down by different categories, and I think the chief is going to be, if he hasn't already, he's going to be putting something out soon. So I don't want to steal the thunder there and let that come out. But I thought it's already been published, but it may not yet.
Okay, all right, thanks, sir.
On these combination of flu and COVID-19 vaccination clinics, is an individual able to do the COVID-19 and the flu at the same time, or do they need some spacing between that?
No, you can do it the same day. It has been cleared by the CDC to be done the same day.
Okay, great.
Yeah.
Thank you very much, and thank you for all of the work that's being done by Cherokee Nation Health Systems.
Thank you.
Dr. Jones, just wanted to kind of clarify something here. I know last month I was targeted for a post that I had placed on social media. We actually seen a doctor and nurse that you brought in to target me in that. One thing I wanted to comment on is that something that I had also addressed in the same week as I had mentioned on social media. As everyone heads into the weekend, please pray for our healthcare workers as they have been battling this for over a year. Pray they can keep finding the strength to overcome the obstacles in their path, finding spaces for new patients, not being able to transfer out patients, and overall morale. If you know anyone in the health field, call them, tell them thanks, offer them a helping hand if you can. Now that's something of a positive post. Okay, so I just want to make that on record because I know the theatrics that was involved in here last month is something of a disgusting display that should never have come into council to do it. But now, as far as the question moving forward here, Last month, I know we had addressed it on some medical providers being lost. One of them that was lost was a good female orthopedic surgeon. We replaced her, though, with a less experienced male orthopedic and paid him more than the female doctor that was being replaced. Now, the other great concern I have over her being and discussing through mutual people is that she's being targeted to not be able to receive another job at Northeastern Health Systems because she wanted to be close to keep continual care for her patients that she either gave surgery to. So I think that is the reflection of what my original post was just questioning the leadership role of our health systems, trying to work together, obviously, and asking questions. But that was just something more of a comment and a concern that I have with our health systems. I know that you are also dealing with a lot as well as everybody else, but trying to target one another in a theatrical display here in the council is not really a place it should have been conducted. But, best of luck. I'm always trying to here to help. I'm always here to try to help get my citizens their questions answered, and looking forward to continuing working to try to get past all these obstacles that are in front of us in the years to come. So appreciate it, Chair.
Is there a question? I didn't receive a question there.
Y'all do a great job. I'm not doing it, but I just got a suggestion. On these, we have some upcoming food drives, and I would have liked to seen that on those food drives that we give those shots. Because just like in District 5 Southeast corner there, well, there are people 25, 30 miles to either clinic. They'll come get their free food, but they probably won't drive 30 miles to get that shot. I bet if we set up at those food places that, they get their food and then they'd be more apt to get their shot. And I know it's too late now because you got 2 pages of this and everything. But in the future, if this gets worse, we have to keep doing it. I would recommend that if we do that food, come out there and give them a shot, and because we'll have 200, 300 people turn up for their food drives.
Yeah, and I'm not opposed to doing something like that. The only thing is that the way this was planned out, and it took several months to get this planned out, is having the people available to go do it because we're so short-staffed. So we
Right.
have to plan it very carefully and say, okay, can we afford to send 2 nurses out to do this? And because when we go out and do it, it's a little different than having it right there at the facility. When we do it at the facility, we can use some of our ancillary staff, but we really need medically trained personnel when we go out somewhere in case someone did have a reaction or in case someone had people get very anxious, and sometimes you can have anxiety attack just from waiting to get, for the injection. So we want to make sure that we have the right people at each event. So I understand what you're saying, and I agree with you. This kind of was one of those things we planned out in the midst of our surges, so we tried to scale it down to where it's functional, but not to where we're pulling people that we need back at the clinics. So, yeah.
I have to respond to Councilman's comments. First of all, there was nothing theatrical about what was done at our last meeting. There were specific allegations saying that our health system was doing things that were absolutely untrue. Absolutely untrue. That is not theatrical. That is actually, we are getting to the bottom of it. You got to have your say. We responded because what was being said wasn't true. There's nothing about theatrics about this. When we put things out there as being the truth on the internet and they're not, they should be addressed. And it was addressed. So there was no theatrics at our last meeting. We were simply giving our thoughts on our health system being attacked for zero reason. Absolutely zero. And you explained yourself rather well, as did your workers. So for the record, that's not the way things went down.
I appreciate that.
It just popped in my head looking at this. Do you think you can run another Hard Rock clinic drive-through the way we did that last one? In that back parking lot?
I don't know that we can right now with the way that we've got everything planned and the things that are already in motion, that we can pull enough resources together to do that right now. It's very difficult to ask people to work on the weekends when they've been working on the weekends for so long. At some point, and especially this time of year as school gets back up, people have families.
Yeah.
And, you know, we're a 24-hour facility at the hospital, and we're asking people to pull extra shifts to keep that open. It's hard to ask people to pull extra shifts right now. And that's what I say, we worked on this, and we got commitments on this a while back to get it in place so we could advertise it and get out there. I'm not saying we can't do it, it's just, it's a little more difficult right now.
So
Yeah.
this whole list is extra shifts?
This whole list is made up of commitments from, you know, the work group that was put together, our nurses, and all the people that worked together to put this to get our public health nurses and things of that nature, and what we could commit to and guarantee that we could make it and not have to cancel it.
Okay.
So that's what this list is a commitment on our part to be at those locations. If there's additional requests, we're going to look at them one at a time and see if we can commit to it with the folks that we need to. If we can, then we will try to do that. But these are the ones that we knew that we could commit to now. Does that make sense? That answer your question?
Yeah, I'm just looking, because obviously my district, the one that does not have a clinic, you know, we have the other third-party clinic, which is working out real good until we expand that. That's what I was trying to figure out, because I have to drive to Collinsville or Ochelata or Muskogee. So that area, we're asking them to drive. And I know we have people that go work to other clinics and get pulled out. That's why I was asking if it was at third shifts or what shifts they're doing, or?
Most of it's during the day, so we're pulling
Yeah.
those people out of their normal day routine to do that. So it's not shifts that we're saying, hey, you've worked 40, can you do another 8?
That's what I was wondering.
Yeah. So these
Okay.
these are the ones that we've, like I said, committed to, but we can definitely look at Catoosa and see if there's something we can put together.
Yeah, because we can do it at the Hard Rock or JW Sam, whichever is easier, but that last one worked really good in that parking lot, the way it was set up. So even if we put it, I'm not picky, put it at the very last one, and then we'll just catch up everybody else.
We'll see what we can work out.
All right. Thanks, Chair.
Canessa?
First, I definitely want to say thank you for all of the amazing hard work that's being done by Cherokee Nation Health Systems. I understand the incredible pressure that has been placed on our health professionals, and it's just amazing that everyone is continuing to function at such a high level in serving our citizens. And while some requests are being made for additional vaccination clinics, I would like to point out that the vaccination clinic that's going to be taking place at Tri-Community Web Building is taking place in conjunction with their Monday, Wednesday, Friday feed times, where they are offering a full balanced meal at $2 per plate for people in the community. And we've got individuals who come to the Tri-Community Web Building from all over Welling, Eldon, Briggs area, including Stillwell, and they have continued to feed throughout the pandemic. So, you know, I think, feed somewhere up to 80 each time. So you are setting your COVID-19 flu vaccination clinic in conjunction with that time when people are driving in to access that high-quality, low-cost food in that area. So I can see the planning and the amount of consideration that has been put into these dates. And I just want to commend you on that.
Well, I have to give credit to our work groups that have worked on that. I can't take the credit for that. They work on that independently, and then they bring it to us for approval, and they've done a great job. So trying to meet as many citizens where they're at as we can.
Any others? Okay, Wes?
Yeah, on something that Counselor Smith and Counselor Teehee had mentioned on the flu vaccinations, and far as the feeding goes, I think that's a great idea that Counselor Smith said. I understand. I think there's some obstacles that would be in the path because we have to monitor the COVID-19 shots after we have food come through. And it looks like you're going to be booked all the way until the 20th doing this, which is, I mean, it's a condensed time schedule. So if when I mentioned to Ms. Pivick about putting a community event on and trying to wait till we could get to a safer zone, I'm trying to get past the 20th. But how far timeout frame would you look at if I sent in a request to try to do flu shots and maybe do the COVID-19 if we did host an outdoor community event. Is that something that your team might be able to work in, considering they have to have that monitoring? But if they're there for a community event, we could keep that monitoring going on while they're getting their shots. Is that a possibility?
I would say submit it, and then we'll see what we can do. 'Cause
Okay.
that's, we don't know what the next 30 days holds.
Right.
And if something happens that we see another surge around the holidays,
Right.
then obviously that becomes first priority.
Right.
So we're only committing out so far at a time, just
Right.
because we're being very cautious.
Yeah, I'm hoping that it drops enough and I can put something before the holiday schedule gets up. And then I think Council Smith had a great idea, which was trying to maybe include getting that. Because I know I have citizens in my district that even though I've met with, they're still not trustworthy of the vaccination. But maybe if there's a group there and they're seeing a neighbor get one or getting a booster shot, then, they might be more engaged and trustworthy of getting the shot themselves. It's just trying to get some of my rural people in my district a little bit more trustworthy of it. But awesome, appreciate it. I'll try to get an idea date submitted as soon as I can to see if we can work that in. So appreciate it. Appreciate it, Chair.
Melvina?
Will this be posted on the Turkey Nation website?
It is already.
It is? Okay.
It is,
I
yeah.
just want to make sure. Thank you.
Dr. Jones, could you just explain what Medicaid expansion is and what potential it has in terms of helping our health system out financially?
Sure. Initially, when we looked at it, it looked like it was going to be about a $25 million increase to us to close that gap. So what Medicaid expansion did is it increased the eligibility. There was a gap of folks or citizens and folks across the state that made too much money to get Medicaid, but didn't make enough money to get insurance and be in the marketplace. So you left this hole of people that were kind of caught in this crossfire. So this closed that gap, and so there's a whole lot of people out there that aren't really even aware that gap got closed. So that's why we've made the effort to identify those people that are uninsured in our system and call them and say, did you know? And start getting with them and offering them, we can help you get signed up if you would like. There's no high pressure, there's nothing like that. It's just an offer that we can assist you and help you get your paperwork done. And so we've done that, and like I said, we've done about almost 7,000 people now that you think about across our system we're coming and we were providing health care for with no third-party reimbursement. So now they have a payer source, and they don't have to use us. Once they get qualified, they can go wherever they want. They can still choose to use someone else if they so choose. There's no obligation on their part to use us once we sign them up. But there's a lot of other benefits that go along with it that they get to tap into. So we're very proud to help do that because it's going to help a lot. Well, obviously, it's helping almost 7,000 people now. Our goal is to hit 10 to 12,000 by the end of the year. So we're just working diligently through that list to try to get people signed up that want to be signed up. A lot of people don't pay attention to that thing. They don't even know that they're eligible. They're very grateful once we get them signed up.
I think Dr. Jones mentioned too that those individuals can go anywhere they want for health care.
Anywhere.
We want to be the provider of choice, obviously, but
Yeah.
they can go anywhere they want. I have one final question, Dr. Jones. Are we tracking the potential of this new Merck pill that's being, provided as a potential to help keep people out of the hospital with mild cases of COVID? What do you know about the Merck pill and the timeline?
I don't
Or is
know.
that something we're going to be looking at?
Yeah, obviously, we'll use any modality we can. We do have some clinical trials that we're involved in. I can't say specific if it's that one, but there are some opportunities that our infectious disease director, Dr. Mara, has. He's always staying at the very cutting edge of that and offering, trying to get us all the tools in our toolbox that we can use. He was very instrumental in getting the monoclonal antibody when it first came out, and we were offering it before anybody was. As a matter of fact, I think we've done more infusions with the monoclonal antibody than the rest of the state. So we're staying on the edge of it, we're staying up with it, but again, we're not going to offer it until we know everything is cleared and safe and ready to use. There are, like I said, a few clinical trials, and if someone chooses to be a part of that, they can, if they fit into that qualification, and that's explained to them, and if they choose to do it, then it's something that they give consent to do. So, but we're not going to offer anything until it has full approval, or at least approved through emergency use authorization.
Thank you, Dr. Jones. Any other questions for Dr. Jones? Guess we're good.
All right,
Dr.
thank you
Jones.
guys very much.
Thank you. I see no old business, no new business. Are there any announcements? Seeing none, I would have entertain one more motion. Second. We are adjourned.